The next cranial nerve to cover is cranial nerve number 5, trigeminal nerve. Trigeminal nerve is also known as cranial nerve 5 or the letter V, the Roman numeral for 5. I'll be saying that letter V quite a bit to differentiate between the three branches. Recognize that the letter V, when said, is the Roman numeral for 5. The trigeminal nerve's origin and course. It arises from the pons. It then immediately has a trigeminal ganglion and then three branches. V-1. I use the word V-1 to represent the first branch of the trigeminal nerve to distinguish it from VI, which is the Roman numeral for 6, the abducens nerve. V-1, V-2, V-3. So here we have, let's talk about this trigeminal ganglion for a minute. There's a cell body of a sensory neuron. So let's take a tissue from the nose, and that sensory neuron courses all the way to the pons. But let's do the same thing from V1 and then the same thing from V3. So there is a collection of cell bodies. It's called a ganglion. It's the trigeminal nerve. There's the trigeminal ganglion. Let's talk about V1, the ophthalmic branch. The prefix ophtho, it means eye, because this is the nerve that courses through the supraorbital fissure going to the orbit and to the forehead region where it does sensory innervation, the upper eyelid, the front of your eye, the cornea, and then the bridge of the nose. Those are the sensory distribution for the ophthalmic branch, and it gets to the eye by traversing through the superior orbital fissure. Cranial nerve V-2 or V2 is the maxillary branch, and as its name implies, deals with the maxillary region. Courses from the lateral corner of the eye to the lateral sort of the nose to the lateral corner of the mouth. So it does bottom eyelid, side of the nose, upper lip. It also does your maxillary region, so maxillary teeth, gums, and palate, and the nasal cavity. It's not so great illustrated in this picture. That was some gooder grammar, wasn't it? To get to the skin of the face, maxillary branch traverses the inferior orbital nerve, the inferior orbital foramen. The mandibular branch. So this is the third branch, or V3. It's going to then give innervation to the side of the mouth, the bottom lip, your chin, cheek, and side of the temple. That's the distribution of the mandibular branch of the trigeminal nerve. It also does your mandibular teeth, which is not really shown in this picture, and your tongue, which is illy drawn in this illustration. But mandibular teeth and gums and your tongue for general sensation, not taste. General sensation is if you know your coffee is hot or the ice cream is cold, but not that your coffee tastes like mocha or that the ice cream tastes like strawberry. That'll be a different nerve. Mandibular branch, that gets to the skin of your bottom lip and chin by this mental foramen, this hole in your mandible. Now the trigeminal nerve, there we have it, has the following three branches, V1, V2, and then V3. It'll do sensory. But it also does motor. So there's a cell body of the motor nucleus of the trigeminal nerve, and the neurons course down the branch of V3, and they go to these muscles of mastication known as the temporalis and the masseter muscle. These are derived from branchial arches, hence why only the branch of V3 has branchial motor neurons. And temporalis and masseter muscle elevate the mandible as in chewing or masticating your food. If we were now to take this area and cut it out, we now see deep to the ramus of the mandible, and then you've got these neurons that innervate these medial and lateral pterygoid muscles, and their function is to move the mandible side to side and up, as in chewing as well in masticating food.